and even in the worst case scenario, it may not be anywhere near as bad as you think the scenario is. So one step at a time.
I have had things that have
You
been
have
isolated in the area.
So I mean, you're a cancer survivor. We don't even know if it is,
Yeah.
and even if it is, people survive.
I know, but that was a difficult recovery.
I don't know if it's going to be that. Let's first find out what it is.
That was hard to hear, though.
Okay, I understand. Well, part of it because you got so lightheaded that nothing was going to be heard because you got a little shock there. I mean,
I was trying.
I know.
I was trying.
That's okay. Yeah, I'd rather you sit down. This is what the plan is.
Okay.
I'm going to call your doctor and tell her that you need a biopsy.
Dr. Kennedy.
Right. I'm going to give you a set of films to take with you.
Okay.
So that if you go somewhere, they don't have to do anything extra. They have everything they need to see from today.
Who do you recommend for the surgeon?
I'll give you a couple of names. I don't know who your doctor tends to send to because we see some stuff from your doctor, not tons of stuff.
I have to think. I'm sure they're probably covered with it.
You got to, Signum's pretty.
But I want to know who's a good surgeon.
I mean, there's right on.
And the size felt like at least 4/4 was like 4 centimeters.
That's exactly right, 4 centimeters.
Yeah. I was guessing. God just tells me that. I'm telling you, I had to. You learn to measure things by objects you know already. I thank you for seeing me so quickly from Sunday night at 10:30 at night, finding it, to Monday morning being in my doctor's for the referral.
On the back of this are 3 names. This is the front is yours, just tells you that you need to have a biopsy. I want to avoid any extra workup, so what we're going to do is we're going to make copies of today's films. We're going to make copies of, and I'll give you the old ones from 2013 so they can see it looks totally different.
Okay.
They don't need to, but you know it's different because it was, you didn't feel it.
That's the films, I printed them out.
Thank you.
And do you want me to do a disc, or do you want me to see if I can print the ultrasound? Just, there's no report, that's all.
Yeah, I have to do the report.
I've never tried to print the ultrasound from up there, but I give it a whirl.
You could,
Print it from the pack.
I guess you could print the
Do they
disc.
know, is somebody down here to do it here, or no?
Yeah.
It's just amazing that I bathe myself every day and I didn't feel anything so profound like
Right.
that. I'm telling you, it never was there before. I don't understand.
I need a big jacket too, okay? I want to give it a 2013. Just give me 1 second. I have to just check something. So they're going to send you to a surgeon who's just going to stick a needle into it. and
Do an
take a-
aspiration.
Well, not an aspiration because it's not fluid. It's not going to come
Oh,
out.
that's right.
They're going to take a piece of tissue, and based on what that comes out, will determine if anything more needs to be done, and if so, what. So it's going to be done as 2 steps, basically.
So I'm done. It's done under general anesthesia then. If they're gonna
No, not
take, really? How are they gonna take tissue out while I'm awake?
Oh, the biopsy?
Yeah.
It's a little needle. It's like having it's local anesthetic. It's not a big deal. It's not a big deal. It's really it's a little lidocaine and a needle going in. Not a big deal.
Then how do they get out solid or anything?
Because the needle has a little cord to it.
Oh, okay.
Just a second.
And my other question was, is that the only? Oh, okay.
I just have 3 people. Patient letter. Yeah. Okay. I'm sorry. Is that
the only significant change you saw on the mammogram?
So I'm seeing the big area and right next to a small little area.
Next to the nipple.
Not next to, no, next to the big area.
Okay.
Right. Just so there's another thing right next to it. It's really so close that I can't technically say it's the same thing.
I saw how that
but
looked like a
but it's
like a
right
bulb and
close.
then another little small.
Little tiny bit around. Right.
Okay.
Everything else looked okay. Everything else looked okay.
So nothing you saw in the nodes in the armpits or anything like that?
I don't see anything there. Ultrasound's a lousy test for that.
So
So the
what would you
ultrasound-
do, an MRI?
Maybe, depends who your surgeon is.
Okay.
Yeah, some will do the MRI, some will just first get a tissue. You're pretty sophisticated, so you one step at a time. Find out what it is. After that, depends whether they get the MRI first.
Beth's
or
got a
not.
headache, so she wants me to do it.
I mean, but cysts you said aren't hard, aren't solid.
Here's her
But you said
jacket.
cysts aren't solid.
Let me know when
Correct.
you want me to print the disc, or Debbie can come in here and print her film.
Oh.
Ultrasound film.
You could print, you know what, print the ultrasound films
From there.
and don't wait for me to dictate.
Okay.
And what we'll do
You
is,
want a disc or do you want a
What?
print? You want-
okay, a disc.
Okay.
And then, once we find out who the surgeon is, we'll just forward a report to
And
her.
we send Debbie back to make the disc.
Debbie?
Yeah, sure, why not?
I can make it upstairs.
Okay.
I now understand what you're saying, so if I'm
He can-
correct.
She can
Right.
print the films. You want her to print the films? She can print them right now.
What?
The ultrasound film.
Yeah, sure.
Yeah, print the ultrasound film.
So if I
already
understand
did
what
the-
you're saying,
The mammo film.
Cysts usually have like fluid, but this is more
Right.
solid.
This is more
But
solid.
solid can also be benign too, as
Correct.
well.
Could be.
And I didn't, but you won't know until, just like with the thyroid, until they did the palpation.
Right.
A palpitation, and they
Right.
took that to pathology to look at it and see, and then they knew it had to come out, and it was able to tell them what type of
That's
what it
exactly-
was at that time, and then they were
exactly
able
the
to
same
treat it that way with an ablation
Exactly
and
the same.
everything else.
Right. Breast, you don't do an ablation, obviously.
Right.
So, but yeah, that's exactly what happens. It's exactly what happens.
I went all the way to the end. When you said that to me, I went like
Yeah.
far left. Well, I'm still.
I can't tell. We don't know that this is breast cancer, but I have people, how many dozens, hundreds that I have in the practice who've seen breast cancer coming from mammograms 10, 20, 30 years later. You know,
But it's so big,
I understand. You have a big breast, though.
and I'm fat.
Well, some saying so. You know, it's not. You know, it is big, but it's not like if they could theoretically even just take that and leave a lot of the breast, or. But again, we're jumping ahead. First one is, it's a little less obvious because of all the stuff you've been on.
Yeah,
You know, all these things cause changes and stuff like that. So
which also could facilitate a lot of
can.
growth because it gives a lot of
That's correct.
feeds.
That's correct. That is a possibility.
And did you see blood flow to the area? You
Should
looking
we
at it?
get this? Were you a nurse or something?
I work at Johnson & Johnson, and I
Unbelievable questions. Some blood flow, yes.
okay. Well, that aids in the growth of it, so it has. Okay.
Yeah.
All right.
I mean, you clearly have a better knowledge than the average person, so you clearly should understand that as though
I know.
this could be bad.
But you know, I went.
This isn't the end of
I
the
was
world,
drawing
right?
on to
I understand.
having thyroid cancer, which even though they said if
Right.
I had the best kind, which was treatable by radioactive iodine, where I just swallowed the pill and that
Right.
was it. It's not something you want to go through and deal with at all.
100%. I'd rather tell you it was 5 or 6 that can be done.
Yeah, I have a master's degree in pharmaceutical science.
Now, there's a process here, and the process will either be very short, meaning a negative biopsy, or a lot more. And that's the next step.
And a lot more just as removal of it for then the first step.
Yeah,
and
a little
then
more of a workup. They
testing.
may or may not do an MR. They may or they will take out a lymph node if they have to check
Okay.
that. And then the prediction is based on the size, the lymph nodes, and the activity of the cancer, the biologic activity.
Mhm.
You know,
If that's
how
based
fast how fast is it growing, how much division there is. All these things are factors, and there are markers. Estrogen. See, the thing is that even if it's a cancer, your chances are it's hormone receptor positive because it probably grew under the hormones, and that has a better prognosis than what's called the triple negative. So I'm saying, so there's a lot of stuff here.
So that's the one where what they do is they suppress the hormones that you get.
Well, the
They-
surgery's got to be done in any
Right,
event.
but I'm saying they do like they suppress
Tamoxifen,
hormones.
Yeah, Rimidex, stuff like that. Right.
Okay. All right.
Okay. All I need from you, assuming that you're okay to go, is when I'm going to send this report to was Gibbons was? Done?
Gibbons.
Gibbons. Right, Gibeon's.
Yeah.
I didn't.
I just had a chest X-ray done a couple of months ago.
Okay. I mean, you'll probably get, depending on what the biopsy is. Okay, now you should try.
Okay.
Had everything done a couple of months ago.
You may need a bigger workup depending on what this comes back. But this is unfortunately pretty common, pretty straightforward. It's almost cookbook what gets done. The only difference is some doctors are stronger about getting the MRI and some are less strong.
Doctor, or you can read
That's
it,
all it is.
and then I can give you.
All right, so we're going to give you the films. I'm going to call your doctor.
Was that a normal reaction, or was that a normal reaction that I had?
A little more. I mean, people get upset, blanking out, and that was a little more, but you're fine. You'll be okay. Look,
I was working on coming too. I was trying.
People come in different
I
flavors.
was trying to come too.
It was. Look, there's a lot. I put a lot on your plate.
Oh,
But,
okay.
Which is a lot in a little bit of time, like in
Right.
48 hours.
I understand, but we will. That's why we're working quick to get this done faster.
Okay.
That's why I'm giving you copies. That's why I'm going to call your doctor, and that's why hopefully we're going to get this taken care of by next week.
Okay.
All right. So, are you still taking any hormones right now or not?
I was just going to the doctor today. I'm canceling that appointment.
What, the fertility doctor?
Yes, I'm canceling that appointment.
We'll cancel the appointment.
I could care less about that.
All right. That's not there right now. All right, as soon as we give you the films and you can stand up without getting lightheaded, I'll let you go. With the,
I think I'm all right. It's just my own thoughts that just keep on coming in and flooding me.
that you're gonna have till you have an answer. I just,
And I just keep feeling like shaky inside, like very agitated and nervous. Okay. I think I can do it. Okay, I think I can do this.
well, we'll start easy way. We'll have you stand up and see if you get dizzy. No, I'm serious. That's the first step, is standing up and see if you
And
get
it's
dizzy.
painful. I don't know why it's,
Here you go. She's told me to give them to you. Do you need them? Okay. This is the jacket.
This photograph biopsy, but okay, so that's why it's from the, okay. Good enough. How you feel? Let me take your pulse. You're good. If while you're driving you get a little pull over, make it home. This will get taken care of, okay? This is not the same disease as it was.